This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, joining me as often is the case is Dr. Stuart Shapiro. He's one of the healthcare experts we call in from time to time. He brings us up to date on important changes in healthcare. He, of course, is the president and CEO of the Pennsylvania Healthcare Association. Hey, Stuart, before we get started, I want to tell you something. I have seen now more demonstrations, more folks lining up in the state capitol than I have in a long time, you know, exercising, what do we call that, their First Amendment rights. Did you have you had a group that showed up and did something too, didn't you?
Yeah, I had a group, but it was really a group advocating for seniors. And from across Pennsylvania came healthcare workers, not professional lobbyists. These were folks who came in the clothes they wear to work.
Right.
These are folks making $10, $12, $15 an hour. And they came and said, protect health care for seniors, and especially the frail elderly are in nursing homes. They delivered a petition to every single legislator.
Yeah, do you hold that petition up? Well, you know.
It really said there were 12,137 signatures.
Right.
There were 100 pages, and it's in small print of 100 pages, asking them to restore the $100 million cut in the governor's budget for the seniors in Pennsylvania who are in Pennsylvania's nursing homes.
But as I said, I've not seen a time when there's been so many sort of demonstrations and meetings in the Capitol and state Capitol. We do a lot of state Capitals programming, as you know, and people, you know, exercising their, whether you like, it's healthy when people go and get involved and make their case known, regardless of what the issue is, right?
Absolutely. But the issue is it's the competition for dollars.
Sure.
And every group comes in to tell their story.
Yeah.
Maybe a group of hospital providers. It might be folks who want more money for drilling.
Sure.
It might be the counties asking for more money for schools, or it might be the universities. In this particular case, they were there to represent the people without a voice. Now, Governor Corbett's a very smart man. And in his first budget address a year and a half ago, he said, we are in a tough economy, and we need to pay for the must-haves, not the nice-to-haves. And he has been a staunch supporter of the elderly, as has the legislature, in terms of nursing homes. In this budget, they made some tough choices, and these folks were here to say, because of federal Medicare cuts, we need some oxygen on the Medicaid side, and therefore we're asking the dollars be restored. Let's
talk about that a minute. Now, one of the things that we just talked about in the previous segment, and this is why it's great to have you on now, is they focus primarily on the education restoration cuts, but also the situation in terms of whether or not $500 million would be in the governor's budget would be increased by $500 million because of the revenue projections that show the state taking in more money. Let's talk about your piece to that right now. Where does it stand based on what the Senate did this week in restoring some monies to the programs that you're talking about now? Are you involved in the restoration?
Absolutely.
Well, talk
that's
about
some
that.
of the good news. Because of federal Medicare cuts, and we could talk about them in detail if you want, but a tremendous amount of money to pay for Obamacare and for other things withdrew money out of Medicare, the services to the elderly.
Right.
And some of that needs to be restored through the Medicaid program.
And is that...
in the state budget that the Senate approved in a bipartisan way, which was interesting because both sides voted for that.
That's great.
Restored about half the cuts for nursing homes, which means that there's a long way to go because the dollars are necessary to provide and to maintain the quality of care that is at its peak in Pennsylvania.
Right. Okay, we're going to run to a break. When we come back, I want to get some perspective on this. $500 million. Has $100 million of it been restored into the medic? How much in dollars do you know?
Yeah, I do. the state cut almost $50 million out of their budget, which is then matched by another $50 million in federal dollars.
So that's how you get the $100 million.
That's how you get the $100 million. And in this budget, it restores about $23 million of state dollars. So it brings the cut down to about $50 million rather than $100 million. So you're talking about
we're halfway there. A halfway cut from what you had all gotten last year.
Correct.
In last year's budget. So that's good. So in other words, the Senate budget, and we're going to run to a break. When we come back, I want to talk about the Supreme Court case and the impact that it might have, the health care case. But let's clarify this. $500 million in new monies added to the governor's budget. $50 million in total from federal and state sources will come back to.
Right, but that's not the comparison. The Senate budget added $500 million of state dollars.
State dollars, that's correct.
The money that's going to nursing homes or to the care for the elderly in nursing homes is $23 million of that $500.
And then that brings in
another.
I got it.
25
That's why we have you
so.
on the program to keep me straight. In June, we expect that the Supreme Court will hand down its decision on the constitutionality of the Affordable Health Care Act. What impact will that have? Dr. Shapiro, we really don't know what the court has a whole bunch of has some latitude in terms of what it can do. As you well know, you've studied this, you're an expert on this. They could just simply say I don't think they'll do that, it's not ripe, because most of it then going to affect 2014. They could rule in the mandate. Give us your sense about what you think what parts of it they're likely to deal with.
I think the Supreme Court has looked very carefully at this, and I think they are likely to reject the mandate that's in there.
Really?
I do.
Mm-hmm.
The question is, what will they do with the rest of the act?
Right.
But when you look at the entire act and what it did, the burden it put on Pennsylvania, it adds 750,000 people to the Medicaid program.
Right.
And while the federal government will kick in some extra money for them for a couple of years, the long-term burdens of that on this state and on every state is enormous. Then to partially pay for this, and this is something that has not gotten written about, they took $15 billion out of Medicare that goes to support the seniors who are frail and sick,
which is for the
right, and they took that money
part
to pay for the mandated part. So
wow.
They've cut back on Medicaid to seniors. They've expanded the poor. They've set few limits on what needs to be done, and then they've laid down a vastly expanded Medicaid program, even in the services that weren't being paid for by adult basic here in Pennsylvania. They've added all sorts of new services.
And if the mandate stays and people have to buy health care or pay a fine, the fine itself, you would argue, is not sufficient to cover the cost that you're just talking about that will be shifted from one program to another.
It will absolutely not cover those costs. And the burden that they're already seeing the increase in cost of the program. And it's very clear to anybody who has looked at that the estimates by the Obama administration vastly understated what the costs are going to be in the out years to Pennsylvanians and to everyone else.
Yeah, we have about a minute left, but my sense about this is that we've just not dealt with the cost of 75 million, people who are now, the baby boomers. We're just not sensible about how we pay for this, that we can't continue with the current payment that we all make, plus the numbers of people who are getting the benefits.
Oh, we can't continue it. And not only that, every time Congress considers something, the sequestration to balance the budget, they took $500 million out of nursing homes and senior care in Pennsylvania. They keep even the payroll tax extension took another $50 million out of the system of care for the elderly.
Great point. Great update. We'll have to get you back when we get this business settled with the Supreme Court. All right, thanks for watching this edition of Pennsylvania Newsmakers, and as always, stay well.